Well, I'm up at Nobles Hospital talking with the Minister of Health, Mr. Anderson, and this is about your first report back on those items that people were reporting here, the hospital staff, the whistleblowers. They weren't happy with certain ways the hospital was run, and you've come up with the first part of this, the critical care outreach team, who are now there to immediately get into work with new patients and any concerns that people have. Is that correct?
That's correct. I mean, the expertise is there within the hospital, but was focused primarily on coronary care unit, intensive care unit. What we're doing here is taking that expertise into the vulnerable people around the hospital, so they have access, the whole hospital has access to these people throughout the working day.
Now, you pulled people from other jobs to do this. How's that affecting other parts of the hospital?
Well, obviously, it means that backfilling has to take place because these are specialised people, they have specialist skills, but at the same time we're training people up to take their place, if you like. So we're using the high quality expertise that we have and rolling that out past the coronary care unit, past the IT unit, giving access to the vulnerable people throughout the hospital. So if somebody has an issue in a medical ward, they have access to that expertise as quickly as possible and intervention in a more timely manner. And that is something that was flagged up as a concern last year, and we've been running this. This is the first of the 5 work streams to address the issues that were raised. This is the most important one because these are the most vulnerable people and patients in our hospital, and the staff have been first class in that they've risen to the challenge, and they're delivering the service. And as I say, it's been in operation now since the 1st of December, and there's going to be a reassessment of that, maybe a bit of tweaking after 3 months to assess how successful it is. But obviously staff are very comfortable with this system. It gives them more reassurance that they've got this expertise to call upon.
I mean, this one's therefore sort of dealt with, although you, by the sounds of it, you need to bring in more people to cover these people who have moved, so you've got something there.
Juggling act, yes.
And money, no doubt that comes down to.
Yes, I mean, it's always a challenge, and always will be a challenge in the health service to find the numbers of staff we require, and as the bar rises, if you like, so will the challenge to supply enough staff to reach the standards that people now require to have in the hospitals. Okay,
4 more work streams to be sorted though. What time?
Well, they are ongoing. Those work streams are ongoing, and we'll be reporting back to the Basic Safety Forum, which is a forum that was set up when the issues were raised initially with the medics. The whole of the Nobles Hospital team was invited to Kildare, and then from that 5 work streams were identified as being needed. They were set up, and they're all working in their own areas now to see how they can address the concerns that were raised in that forum.
Can I talk about you now? You had to, well, you voluntarily put yourself forward, reported yourself for maybe misleading the House on this whole thing. It's come back in, I understand, the report said. Do you want to tell us what it said?
Well, I'll be reserving my comments, as you probably could understand, to Tynwald, but I'm pleased to say that I have not been found guilty of knowingly misleading Tynwald, which was why I referred myself to the committee. I have issues with the committee's report, but I will be making those comments in response to that in the Tynwald Forum.
Because I mean, I've heard that, there's selective words that have been put in to say that you're not responsible, but it's a very dubious sort of word that sort of you could take it one way or the other. You want any comment on that at this stage?
No, I'll be making the comments in the forum that I should make them in, and that is Tynwald a week on Tuesday.
And there has been criticism of your senior civil servants also. You're aware of that?
I am aware of that, yes.
But will you take action on this?
I'll be making comments about those comments, if you like, nearer the time.